here in Hardee County. And we expanded our clinical services department and continue to expand on our research and development, our platform. And 2 months later, we know that we needed more space to grow. And so, starting in 2015, we saw that Medicare started to pay for the very thing that we were doing 2 years before. We embraced that, took the money from the $5 million Series A, and we began to provide chronic care management services, which is really care coordination between the points of care, which are in time, and then the nodes of care, which are between different physicians. Today, we're now the leader in that entire space. Next. So what is CareSync? So CareSync is a leading provider of software and services for chronic disease management, combining 24/7 nursing services to facilitate care coordination among all patients, family, caregivers, and all healthcare providers. And I'd like to stop there for a second. This is probably about my 20-something time at this podium. And when we started this project years before, we had said that if we build a platform, we build a place where people could share information, and we did it in healthcare. There were so many needs in healthcare that from it would come lots of jobs. And that seemed almost completely out of reach for many people. They thought that we were completely trying to sell the population of Mars or something. It was the most ridiculous. But it really was true. It was that the fact that healthcare in many ways is broken. That healthcare is a $3.2 trillion industry in our economy, and we waste more just in drugs adherence than we spend on the Department of Defense in any given year. So there was opportunity, and I think many of you, if not most, all but probably just a very, very few, actually believed in that. And I think that it's somewhat almost ironic or somewhat providential timing that I would actually speak after somebody gave you a report on how you added $1 billion worth of economic development. I meet and go all over this nation talking about what I do. And you have been one of our earliest supporters from a venture capital perspective. Some of the most brilliant minds from Silicon Valley to New York to Boston to all points in between talking about what is the vision on fixing healthcare. And I always get to talk about the fact of how we started in a place where no one thought it was possible. And though I came to this podium many times and sort of said things that I know that most people thought, well, it's so crazy, it would be easy to heckle it. And many of you I got to go somewhere else. You had to sit here and go to church with them, live, work, play with them, and I'm sorry. But you were right. You were phenomenally right. Next slide, please. Today we have over 140 jobs in Hardee County, generating over $5 million in payroll benefits and other types of checks that we literally write to Hardee County. That's a lot of money. And that doesn't add multipliers of anything else that money is done with. We are putting back a lot more than we ever took out. But that's exactly what your plan was. Your plan was to seed something that would be a crop of professional jobs in something that was recession-proof, and you did it. Next slide, please. So much that we actually ran out of parking at Tech River, which is kind of ironic considering so many people kept somewhat of a photo album diary of how many cars were in the parking lot. I haven't seen so many lately. I guess that sort of is not fun to do anymore. But the point of it is that we now are doing our next round, where more people are coming in. We will raise by November almost as much as we raised in October the year before. CareSync raised, and I don't know if I said this here or not, but CareSync raised more money from outside investors in Q4 of last year than any other company in the state of Florida. Meaning that if you were to rank all companies that raised money in 2015, and you were to divide them up in quarter, we came in number 1. And that was from the momentum that you created years before in places that Tech River training program and rehabilitating a building and putting things in like healthcare and technology, 2 things that the county wasn't known for. We put them together. It seemed like a moonshot. Now we have raised $31 million in 22 months to build on what you started here. And I'm really, really proud of that because That's sort of the financial side. But the other side of it is that Medicare said, we need something like this. And the this, if you were to look at it, was CareSync Plus. Medicare came 2 years after we built something and said that's what this country needs to specifically address chronic disease for Medicare beneficiaries. I am very excited to also tell you that Medicare expanded that program. We now have one code for 15 and 16. We now have 4 codes to build. So we have 4 distinct different things that we can now build starting in 2017, which does what? And matriculates back to more jobs. So we expect that we will be hiring between 200 and 300, basically maxing out the population density of this area with really more jobs than what this town can provide. But this is still the heart and main campus of CareSync. This is where all of the programs that we launch and try start here. And we have had a lot of people who have reached a lot of other people. And the fact that we have proven, we have been to DC, we have lobbied, we have told them what we've experienced. And in part, they expanded chronic care management to now include complex chronic care. There are patients, some of which, as you might imagine, want to talk a lot on the phone. Some of those patients will actually take up 900 minutes of our time. Now, one of the things that I told you that I felt very, very strongly that was a secret ingredient to this town was your culture. I said that you are naturally caregivers. You naturally care for one another, so we could take people and care for others throughout the United States. I said that that was very much a rich resource that you had that was native to this town. And we built off of that as a real working model. With the advances in chronic care management, I can tell you exciting things that you wouldn't believe me if I told you. We are signing up large hospital systems. We are raising more money because we will do so much business in 2017 that it's hard to even fathom. And in terms of the number of bodies that we need to do that, that is where we now have strategic conversations in the boardroom, meaning that we will be maxing out not just this campus, but Tampa campus and looking for a 3rd campus next year, just for the sheer sense that the numbers of people that we need in the technology-enabled service product that we created is the most successful in the United States of America. We own more percentage of the market share of chronically ill people that are cared for this program than the next 5 companies combined. We own the market. We dominate it. And the fact that we are able to continue to raise money to fund it, I will tell you that just in the last few weeks, we have gotten agreements with hospital systems that are 9 systems, and 12, and 11, making up tens of thousands of physicians. And in some cases, we would dominate the entire state within a particular region, meaning that we will be affiliated with and delivering chronic care management. And I don't bring it up because it's just not things that we do in terms of intellectual property. But the point of it is that you will continue to see large hospital systems using us for chronic care management. The reason is because we're really good at it. We started it in 2013. Other people are now getting into it and they don't understand. One of the largest companies that is a payer in this nation is currently contracting with us to do their care coordination, despite the fact that they already have 40,000 of their own nurses. I did say 40,000. They have said, we can't do it as well as you do it. And the point of it is that we started with a dream. We swung for the fences. For a period of time, it wasn't particularly popular, but we stayed the course. And I want again to tell you that by November 1st, we'll raise almost another $20 million to this company. And that will come right back to Hardee County and other campuses that are in the CareSync family of campuses to still continue to do what I knew was the right thing to happen. And I think without you, it wouldn't exist. And with that, you would not knowingly be touching the tens of thousands. There's over 100,000 people who use CareSync now. Your ability to not just create jobs, but how you have added to the lives of so many people. We are live deployed in over 30 states. We have users with mailing addresses in the program in 44 states. We've darn near saturated the map with our outreach. Next slide.